what are the important precautions that you have to tell the patient when you do a visual field? Before you have to do a visual field, write in your prescription very clearly what is the strategy of the visual field that you want for the patient. So you have to write whether it is 10-2, 24-2, 30-2. You have to write it before you basically order it. Second thing is the instructions to the patient. Always tell the patient to see there is a bowl and there is a bright yellow fixation light that comes. So you have to tell that you do not have to basically search for the various lights. You have to basically see the center of that light, and it is a very good idea that you do a visual field for yourself before you order it for a patient. So you have to tell the patient you have to fixate a yellow fixation light and you have to blink normally. Okay, so sometimes the patient gets confused whether to blink the eye or not to blink the eye. So what you can say is that whenever you see a light, you press the button, then you can basically do a blinking movement of your eyes. Also very important here is that if the patient is an old age patient and he gets tired, let's say you are doing a CETA standard, if he gets tired, you have to tell the patient that there is a button. If you basically press it for a long time, it would basically cause a pause of the test, and whenever you are feeling better, then you can basically restart the test. Also tell the patient what would be the general thing that would be coming in the perimeter. You have to tell the patient that there would be some small lights, some bigger lights, some dim lights that would be coming here and there in the bowl of the perimeter, and whenever you have to see the light, it's like a video game. You tell them that please enjoy this test, and whenever you have to basically see the light, you have to press the button. So these are some very important points that you have to tell the patient before you basically start your perimetry.